My name's Lily Makurah, as has just been said. So I'm Deputy National Lead at Public Health England, and I have a particular lead role on the developments around prevention. And some of the people who I've been working with a lot over the last year from a national perspective are in the room, and I hope that today is the beginning of being able to have more people around the country who will help us with some of that local development and taking that international. So so I just thought I'd sort of start with a little bit about just the wider context of where prevention's fitting in nationally, a little bit about Public Health England and where we're at the moment. So for those of us who aren't familiar with Public Health England, and there still are some people who aren't, and that's okay, is that we were formed just over 3 years ago when there was the restructure of the of health organisations, and we are the lead advisor for local authorities primarily, are our biggest customer, if you like, in terms of that we always want to try and make sure that local authorities, health and wellbeing and boards, and those who work on a local footprint or in partnership with other areas actually are able to benefit from our products and advice and guidance. But we're also formally the advisor on public health to the NHS, which is a very important role and very relevant as we kind of go on and for your future working. There's a national team, which I'm part of, but also others of you will be more familiar with the PHE centres. So there's 9 of those around the country, and they are kind of what we tend to call the front door, but equally, actually, we also have a no wrong door approach as well. So again, particularly where we're in development mode, which is what we're doing with some of the prevention work. So again, equally, you're as welcome to come to me and others, such as Mental Health Foundation, for advice and support as you are to go to centre colleagues. In terms of our approach, actually I've just realised I'm standing right in front of the slide. I'll just move this way. In terms of our approach, we've adopted basically the World Health Organization approach, which is these sort of 3 domains. And today we're particularly focusing on the mental health promotion and prevention elements. But I think it's interesting, useful to always kind of have this in mind, because of course none of this is, very few elements are actually exclusive to one part. So the work that we're doing, again, I'm thinking about today in terms of prevention plans and prevention concordats, actually will also have a benefit to improving the lives of people who have a long-term mental health condition, and similarly with suicide prevention. So it's all interconnected. We also think as well, fundamentally, that if you don't take into account things like Marmot, we know, well, what we commonly know as Marmot, but actually you probably also know as being actually kind of sound sense as to how you develop sustainable and cost-effective approaches, then actually you will not really have enough traction or enough scale to your endeavours. So that is making sure we kind of take into account the life course, making sure we're doing an element of targeting and tailoring, and that sort of making sure that those who are at highest risk or from vulnerable communities actually get the greatest levels of support. We take into account place, which is both the concept of area and settings, and the geography of where people live, work and play, and also again the wider social determinants. And clearly at the moment we are in an economic and political environment where actually that is manifesting itself in terms of even more limited public sector resources, and the pressures on families and communities are greater than they have been for a long time. And again, we're kind of trying to make sure that we factor that in. But we also have some opportunities. So those are one of the newest ones is for those who. I should be interested to know how many of you are linked in with your local strategic partnerships and also sustainability and transformation plans. Oh, excellent. Right, so there is yet another change that's taking place at the moment, and again, I say because it is relevant for all of the conversations today. So whilst we are the approach for everything in terms of where we look at things national is that it's kind of local first. It's localism has primacy in a sense, and traditionally, the last 3 years tradition has been about local authorities or CCGs and that sort of quite small footprint. Over the next few months, you will also see the development of what we're calling sustainability and transformation plans and footprint areas. And what that's doing is clustering areas together to look at health economies where there might be an opportunity for greater commissioning, more effective commissioning based on health economies. So there was I haven't brought the map, but you can look it up, and there's going to be 44 of those areas. So, for example, Greater Manchester is 1, London is divided into 5, and then the different kind of clusters around the country. The advantage of this, so that brings some challenges because there are some times where people haven't worked together before in terms of the pairings and groupings. But the opportunity is that, again, you've got a chance again for work to raise prevention, because again, part of the reason for putting people together is partly efficiencies, but also to get there is an underlying and explicit but also explicit requirement for those areas to be looking at prevention as well, and that's prevention both around physical and mental health. And so we're making sure that the guidance for those areas is referencing prevention, work on prevention, including mental health. And so I encourage you to get involved in those discussions where it's appropriate to your role, or just to keep an eye out for where that may have a benefit for you. Then, in terms of the work on preventing mental ill health, the other opportunity that has arisen since the publication of the Mental Health 5-Year Full Review, which was the report of the Independent Mental Health Task Force. Now, quite a lot of that report actually is particularly focused on services, and that was absolutely right in terms of making sure that the changes that we need to make in terms of transforming that are achieved and are achieved well. And what that's also meant is that there's been quite a large injection of money into the NHS, specifically the NHS, to make sure that change happens, with things like reducing waiting times and enabling earlier intervention or access to earlier intervention. There was a lot of interest in prevention, and it was one of the priority theme chapters for the report. And one of the key recommendations that came out relating to that is the one we're going to again link into today, which is about the development of the Prevention Concordat. Now you see that this is exactly what's written in the report, with the addition of a couple of words. And again, I'm take you through now, which is that of course you can't do Concordat. Terminology was taken from the Crisis Care Concordat, which was about making sure that if you're a person in crisis, was never turned away from anywhere. Obviously, with prevention, it's not quite that simple. There isn't like that one question that everyone could ask and answer. And so we have always taken the approach that this cannot be delivered simply by PHE. It has to be in partnership with others. And actually, we've got a willing number of national and local organisations who've already said that they would like to help engage on that. So, for example, during the course of last year, we set up the National Prevention Alliance, which is a collective, well, it's a semi-constituted collective, key organisations, which include Public Care for England, a lot of the Mental Health Foundation, Centre for Mental Health, and some of the large mental health related organisations. But importantly, we've also got on partners like housing, like some of the major cancer charities, Age UK, etc. So in recognition of that mental health is a range of people's business, and to make this happen, then we need to do quite a lot and involve a lot of people. So also as well in the, again, what you will have read is that, we are going to be producing a JSNA to help people do planning, which we are. That's coming out in November now. But also work around some guidance on plans and return on investment tools, and they're coming out. But what we realised very quickly was that if you take the Crisis Care Concordat model, then actually what you do is you start off with a top line question that's national, and then you don't really, and then you're almost essentially trying to steer everyone into one funnel. And one of the benefits, actually, I think, of learning from some of the work that Southampton's done, and a couple of areas around the country, but it is still relatively new, is that actually we needed to flip everything round. And originally these slides actually were written, this text was written the other way around, pretty much. So what we're now going to do is look at we are very clear that actually we do need to make sure that we have some some headline asks and some key themes. So we are, but we're, and we're starting to shape those. So things like leadership as a strand. There is likely to be something about risk factors and protection factors, and also, again, acknowledging some of the work around suicide prevention. But again, my job today is also to be listening to what you're saying as well. But the important thing is that what we want to do is make sure that we do take a local first approach. So the exercise from me and my team, small team, is making sure that we're very conscious of what's already happening well in terms of some of the examples like Southampton. How replicable is that, and which are the bits that actually are core that needs to that all areas need to do. Now, my view is that picture will combine some things like sort of using the local levers, like, for example, with prevention. If you don't have, it may sound very simple, but if you don't have some basic things in place, like actually good and effective safeguarding arrangements and good arrangements around protection of children and vulnerable people, actually you're not helping break the chain. So things like that are almost going to be part of the core headlines for those really helpful. And then we're also then going to have elements within these themes that are actually more about the things that you more commonly recognise about the prevention of mental health intervention. So the job over the next few months is to, again, we're going to be having a number of stakeholder events as well to pull this together, which is about, what is it that are the best examples? What tools do we need to do in terms of making sure that you have the best available data to do that? So I've said GSNA. We're also doing, in July, we've already commissioned the London School of Economics to do a refresh of the top 12 best buys, that's in the health economics based best buys for prevention, and that will be out this summer. And then again, we'll be looking for what are the things that you would like us to do. We've also already start to pave the way for you in terms of making sure that prevention plans are ready for mentions in things like the FTP guidance, and also priming our senses to be able to support you. And as was already said, is that this left-hand column is this kind of like what is this prevention plan, and then from that we will then pull out what are the things that can only be done nationally or should only be done once. Now, much as I would love to say that if we identify that the changes in benefits are causing mental ill health, that we would change that, that's not my gift. It's just not. But there might be other things that that are as impactful in terms of making sure that it's either easier or more sustainable for you to make the changes. So the changes that are within our control, we will try to make with, and again, that's going back to the with others, which we, given as Public Health England is actually part of the civil service, we actually do have an ability to have conversations with all the government departments as well as with the voluntary sector. So we've already got some clues on what those things will be. It's probably likely to be something around housing in there already, but again, we'd like to hear your ideas over time as to what is it that would make a difference nationally. And so, as I've said, again, it's a time of exploration. We've done a sort of initial sort of scoping in terms of like structure or outline structure, but again, there are things like actually making sure that we have the scope correct, that we actually do have, we must and want to make sure that this is not only that people have got plans in place by next year, but actually that we are also starting to show a difference by 2020, and as well as like being on the right trajectory, but actually already having made changes. So things like perinatal mental health and that sort of early years work is going to be vital. And again, the other thing as well within this is that we must make sure that the work that we do does not leave anyone behind. So that it's also about sort of closing health inequalities as much as it is about raising the bar overall. So it's quite a big job in a sense that we all have. And I think that my responsibility is as well. This is an example of some of the work that we've done before, but we are bringing out more. One of my jobs, as I've said today, is to make sure that we are making sure that this is tailored well based on your experiences, and also that it's an invitation as well for you to set us some challenges. So it's not quite bring us all of your problems, but bring us some of the challenges you've had, that you actually also potentially have some thoughts about solutions to, or examples of practice that might work well at being showcased or shared within the guidance that we put out. Because we do know that although again the national framework situation is not that we can sort of tell everyone what to do with a wagged finger. However, but what we do know is that wherever we are able to showcase best practice and raise the benchmark, then others want to follow, because no area actually does want to be kind of almost in that sort of lagging behind area. But clearly also people want solutions. And also the combination, the recipe, if you like, or the recipe that we need to be developing over the next couple of months is that, again, what are the key components, and then what are the optional bits of the recipe in terms of sort of what flavour cake do you like for your area. These are some of the examples of practice that we've done so far, but again we've also got, I keep mentioning the Mental Health Foundation because there is one of our next resources that will come out with one from them which is about guidance or advice to local areas about some of the recommended actions in terms of what we know that the evidence base says that you can do. And again, it's very focused on the local picture rather than the sort of academic or conceptual issues that sometimes you can find with what we're really keen on being practical, which is, I think, again, sort of reinforcing why today is particularly important in terms of the journey that we've got to go on together.
Thank you very much.